Good afternoon. I'd like to call the hearing on the House Administration to order and thank all of you for coming and participating. The subject of our oversight hearing today is management of the asbestos and hazardous substance at the Smithsonian Institute. This is our first hearing on the Smithsonian in the 111th Congress. We will receive testimony from the Secretary of the Smithsonian Institute and others on the Smithsonian's effort to control asbestos and other hazardous substances at its facilities. A story in the Washington Post on March 15th raised issues about the Smithsonian practices focusing on the National Air and Space Museum, which is the most visited museum in the Smithsonian complex, indeed in the world, with more than 6 million visitors in the year 2007. We are concerned about how well the Smithsonian has been complying with federal laws and best practices in controlling asbestos and other hazardous substances that the staff and the visiting public may be exposed to. Millions of visitors to the Smithsonian facilities and the thousands of people who operate and work in and around the buildings deserve to know whether the Institute is ensuring their well-being. We are also concerned about how well and how frequently the Smithsonian communicates with the staff about exposure to and control of hazardous substances. What is the expected role of the staff in controlling and abating hazardous materials, and how good is their training? We would also like to know whether the Smithsonian standards are uniform or vary from museum to museum. How can the institution performance be improved? In the last Congress, the committee held an oversight hearing on the Smithsonian governance practices. During that period, the Smithsonian was attempting nothing less than a cultural revolution. An insular management style presided over by a part-time board of regents, supplemented by reckless fiscal practices by top officials and inconsistent personnel policies, is being transformed into a full-time professional operation worthy to receive federal funds. This transformation is still a work in progress. I hope to hear and I welcome and thank Secretary Clough that improving handling of hazardous materials will be another product of the management changes. The committee has also extended its oversight over the appointment of 9 citizen regents who serve on the Board of Regents for up to 2 consecutive 6-year terms. The committee has 2 such citizen regents nominations pending before that at this time, and we have postponed action on them until we could conduct this oversight hearing. I thank the ranking member, Mr. Longworth, for being here again and showing up and letting us get this hearing underway. And I also thank the Secretary Clough for being here, and need to make a little point that a lot of this is you're here receiving this. You weren't there when this happened or anything's happened in the past. You were a part of my statement that says we are transforming, and we feel really confident and good about the fact that this has been transformed. The whole operation, I think, from the top down has been revamped, so to speak, and you are now at the helm, and we are confident that any problems that existed that were in the past will be rectified. We think we've been monitoring so far. They have been being rectified. You have been open with us. You have been a constant cooperation between our staff and your staff, ourself and yourself, and we do appreciate that. But I would now like to recognize Mr. Longworth for any opening statement he would like to make.
Thank you very much. I thank the chairman for calling today's hearing regarding the presence of asbestos at the Smithsonian Institution. And while we know the mission of the Smithsonian is primarily to serve as our nation's premier cultural institution, the men and women who make it possible to deliver on that mission should not be forgotten in the process. There are many competing priorities that exist in running an organization that's the size and scope of the Smithsonian. But the institution cannot lose sight of its responsibility to ensure that the handling of hazardous materials buried deep within the museum's walls is conducted with a full understanding of potential health and safety implications. As we've seen with past cases of exposure to harmful elements, these problems do not simply go away because we wish them to, and they must be continually addressed through an aggressive management plan. We must anticipate these issues and take decisive actions once evidence of hazardous materials in the environment becomes apparent in order to protect the employees and contractors who may be exposed to these elements. One way to prevent long-term exposure to these hazardous materials once they're found is to increase communications between the safety officials within each museum, as well as among the museums that make up the Smithsonian Institution. In reviewing the timeline of events related to asbestos issues at the Smithsonian's National Air and Space Museum, it appears that asbestos awareness training sessions were neither as comprehensive nor as regular as they should have been, given the staff turnover that would have likely occurred at the museum since its last comprehensive study was conducted in 1992. The deficiencies in awareness and training for employees increase the risk of asbestos exposure. Now again, Mr. Secretary, you were here as the person, I don't know if you're like the fellow following the elephant in the circus cleaning up, and then we blame you for what you're cleaning up, but we do appreciate the commitment that you've made to understanding this issue and its importance to the continued operation of the Smithsonian. Therefore, I look forward, as does the chairman, to hearing from you as to what may be done to fortify communications protocols among museum officials to ensure that lapses such as those that we saw at the Air and Space Museum do not recur in the future, either at that facility or any other in the Smithsonian's jurisdiction. And finally, I understand that today's hearing is being held in part due to the alleged asbestos exposure of one of the Smithsonian's longtime employees. And while we're not here to discuss the merits of a particular case, we shouldn't interfere with the cases going forward. Whenever an accusation of this type is made, it is our responsibility to ensure that a culture of openness exists and that employees who act as whistleblowers are taken seriously and not subjected to retaliation. That message has to go out loudly and clearly. So I thank our witnesses for participating in today's hearings and look forward to their testimony. And as you know, Mr. Chairman, we're probably going to have votes that interrupt, but we will do our best effort to be here for it.
Thank you. Mr. Harper, any statement?
No opening statement.
Thank you. We welcome today the Secretary of the Smithsonian, Dr. G. Wayne Clough. Dr. Clough, the Regents chose you last year after a rigorous year-long searching process. We have the opportunity to talk to you several times since you took office last July, and I appreciate your efforts engaging with the members with that on a regular basis. This is your first appearance before the House Administration Committee, and I'm pleased to welcome you. Your formal statement will be entered into the record. Normally, ask witnesses to speak for 5 minutes, but we will not put that time limit on you. You can speak as long as you want. Secretary Clough.
Thank you, Mr. Chairman, and to the other committee members. Appreciate this opportunity to testify on behalf of the Smithsonian. Let me begin by assuring the committee, as well as the American people, that all of our museums are safe, they are open, and they're free, as always, and that's one of the reasons we have a very large attendance at the Smithsonian. We've never had any indication of public asbestos hazard in any of our museums. The safety of our employees, volunteers, and visitors remains our highest priority. The Smithsonian, I believe, has an excellent and an improving safety record, as you can see from the chart over here that I'll refer to shortly, and works diligently to comply with OSHA and EPA regulations and standards. Based on our calculations, the Smithsonian's total recordable injury rate is below the Bureau of Labor Statistics' national average of all museums, historical sites, and similar institutions. For the past 4 years, we've been below that national average benchmark by more than 60%. And for the same time period, we are 45% below the federal government average, as you can see from the chart where the rates have dropped well below the benchmarks I just indicated. Now, there are reasons, I think, to be pleased with the progress that's being made, but as pleased as we are, our goal is 0 injuries for our workers, and we'll continue to seek to improve, I promise you that. And I've submitted details of our safety programs that are intended to accomplish this to the committee in the written testimony. We are certainly concerned by Mr. Pullman's health and well-being, and we take his complaint seriously. I assure you, he has been and will continue to be treated fairly and equitably. Any worker at the Smithsonian has the right to call attention to safety issues on the job and always will, and that's written clearly and plainly in our policies. I know something from personal experience about what hard work is. My dad never went to college. He was a construction worker and traveled the country installing industrial HVAC systems for York air conditioning around the southeast particularly. He broke his leg and never fully recovered from a fall off a ladder. I worked my way through college as a surveyor for the railroad company and a delivery guy for Sears. As a civil engineer, I worked on design and construction of major infrastructure projects all around the country. And I've spent time on underground projects, which is one of my specialty, with the sand hogs. I respect hard work, and I value the people who do it. I'm also a father and a grandfather. My wife, my children, and my grandson and I visited the Air and Space Museum within the past 2 months, and I would visit them again tomorrow and the next day, or any of our museums. They're all safe. We do conduct and have improved our safety and health oversight operations and have an extensive safety and health communications and trainings program, which I believe, based on the studies that I've done so far, have steadily improved, particularly over the past 3 or 4 years. Every year, in each Smithsonian museum and facility, from here to Hawaii, from Boston to Panama, we conduct annual comprehensive evaluations of those facilities. Reports are issued where we assess fire, occupational safety, industrial hygiene, radiation safety, environmental management, and compliance requirements, including asbestos. We track mistakes and have a tracking record of implementing solutions. A lot of progress has been made. Work needs to continue. We've also targeted training program for staff and volunteers working with hazardous materials in hazardous areas. In addition, we have safety coordinators for every building, and they meet every 2 months to discuss safety issues, including asbestos, to try to fix any problems. That's why we believe the situation we're here to discuss today is an exception. But it was an oversight on our part. We admit that, and has since been corrected. To respond to the concerns about asbestos exposure and preclude any future problems, particularly on my watch, I have directed the following steps be taken. First, a complete review of our asbestos safety policies and procedures to include interviews with workers and oversight by an independent outside workforce safety expert. This will be underway shortly. The expert will report directly to the Office of the Secretary. And to ensure candor, our workers are going to be free to make anonymous comments. Second, to validate the effectiveness of our annual environmental safety assessments, which, as I described, seem to be in good order, but we will conduct an independent review of these processes. Again, the independent expert will report directly to the Office of the Secretary. Third, for all current and former Air and Space Museum employees who believe they might have been exposed to asbestos in the performance of their work, we will provide free medical screenings as well as consultation with a known outside expert. Fourth, asbestos safety will be an agenda item at every bi-monthly meeting of our safety coordinators, and they will keep museum directors apprised of the safety issues if they arise. Fifth, in addition to the carpenters, plumbers, welders, pipe fitters, electricians, and others who have already received mandatory asbestos safety training, all exhibits production employees have been mandated to undergo similar training. Sixth, any current or former Smithsonian employee or volunteer concerned about asbestos-related disease is welcome to visit our health service office, free of charge, to discuss any questions. And we are going to bring in a medical expert to provide a lecture on these issues for all employees that will be made available on our intranet. As we know, asbestos is a challenge to many in the public and private sectors, including the federal government and its many buildings in the nation's capital. The Smithsonian owns or leases hundreds of buildings, in total about 12 million square feet of space. Some of our buildings are new. The oldest is more than 150 years old, and more than half are over 25 years old. My office is in the Smithsonian Castle, which was completed in 1855. Since 1990, the Smithsonian has spent more than $15.5 million in asbestos abatement processes. And since 2000, the Smithsonian has spent more than $170 million in safety and security improvements to protect visitors, volunteers, and workers. So I want to assure you and the public that our museums are safe. We have 6,000 employees and an equal number of volunteers. More than 25 million visits in total are made to our museums annually. The safety of all of these individuals is our primary concern. We will continue to listen to our workers, visitors, and oversight committees and respond to all safety concerns as quickly as possible. We will take the actions that I have indicated, and they will be done promptly. Again, thank you for this opportunity, and I'm pleased to answer any questions. I have several other colleagues from the Smithsonian who work in the safety area and the facilities area. In particular, General Jack Daly, U.S. Marine Corps retired, who's director of the Air and Space Museum, is also here to answer questions. Thank you very much.
Thank you, Mr. Secretary. Mr. Secretary, you said that you started, all this training started. When did it start? Since, on your watch since you started?
No, the training process, I would say, was begun, an overhaul was begun about 2006, and in 2007, a new program was instituted. So that started with the development of a new safety manual and set of policies, and it's a very large document, but that was put in place. Building coordinators were identified. They began to have these regular meetings that I referred to, and gradually that branched out into a broader set of policies for discussion of issues with employees.
But prior to 2006, there wasn't that intensive training?
They had a different kind of training, and I'm not familiar with that, but we do have people here who can help you with that. But at that point, that's when you began to see significant improvement in our safety processes.
You see, the contractors are trained themselves, especially the pipe fitters, steam fitters. They deal with this all the time, and they have their own training. But I'm more concerned about the staff. And some things that are in the building or have been in the building for a long period of time.
Sure.
That they don't know about the asbestos, and then, you know, it's something that's extremely dangerous. Knowing myself being in the construction field, and even though the contractors, most of them all do have their training, they don't know it until they actually come across it. You know, and the men and women that have been working there all them years maybe don't know it until there's some work being done.
Sure.
I would hope that you would look at some of them and look at some of those issues that, you know, inspect your buildings and have the staff have as much knowledge about the asbestos as a contractor would, because they are trained for it, you know, and include that in your training, and maybe even take a look at some of these buildings that have not been broken into. The walls, you don't know if there's asbestos behind these walls until you put a hammer through it.
Right.
And a lot of it's encapsulated anyway, maybe not properly, but it is encapsulated and does leak out, and it's not an excuse why we shouldn't, you know, encapsulate it even further. But if you could have some of the staff people that are there all the time, have them, train them, let them be knowledgeable in case they run into something, you know, and protect them.
That's a good point. There is a training program for employees. You start with a very intensive program for a small number of people who literally are on the site of asbestos and abatement activities, because we have some sort of renovation going on in some museum at any one time, all the time. And so there are a set of our employees who are certified to be there and to work under those circumstances and work with certified contractors. Of course, contractors to work at the Smithsonian have to be certified that they know how to deal with asbestos. So we have that group of employees who have mandated training. Now we've moved that mandated training up to include another category of employees that we did not include before, and that would be those who work in exhibits. And so they don't do the heavy work. They're not working necessarily directly with contractors, but they do indeed come in contact with the walls and with facilities attached to the wall. And those people will get mandated training from now on. We, in addition, have a so-called screening or briefing process for our employees, particularly if we know we're going to do work in a museum, and that happens from time to time. So they will be given the opportunity to come into a briefing to understand what will happen to that building and how they should be protect themselves should there be an issue, and what we will do to protect them, what measurements we will take, what actions we will take should there be an incident, those kinds of things. So that level of training and that level of briefing has been ramped up. In addition, on our website, there is always a statement about these processes and procedures. So that has been improved as well.
Most of this current focus is on the Air and Space Museum. You're also having this training and all this, and this knowledgeable, with letting the employees be knowledgeable of what their surroundings are on all the other museums also?
Every one of the museums, as well as all the other facilities. I mentioned we have facilities in a number of different countries as well, in a number of different locations. And in all those cases, this information is available. That level of training is made available to them.
Your contractors, I know you have some special bid contracts. I'm sure you have some emergency contractors, but they're supervised by staff?
I'm sorry, say that again?
The contractors themselves doing work, who are they supervised by?
Yeah, the contractors are their services, if I get this correct, let me answer it, and then you can tell me if I got it. The contractors obviously go through a bid process to work for us, but we do have, when you said contractors, I may have misunderstood it.
We have some emergency contractors that are on a certain list, I'm sure.
Yes.
With emergency, you can't put out the bid. You got a pipe leak and flood in the building.
We do. We have contractors that we work with regularly who do monitoring for us and who come in and do safety work for us and prepare for abatement processes with us at all times.
And the staff? I'm sorry.
And then in addition, when we contract with a contractor, they have to be certified that they are prepared to deal with asbestos issues. We have a study that was done back in the 90s, as you referred to, that identified the location of asbestos and likely location of asbestos in the museums. We're in the process of updating that study because as a result of the $15.5 million that we used in abatement, we took out a lot of asbestos. And so we're documenting now where that no longer exists and where the likelihood still exists that it would be there. And so when we contract with someone, they were informed about that information that we have as to where they might encounter asbestos.
So what you're telling me that contractors, all staff employees, people that are supervising contractors, all of them will have this, contractors more or less have the knowledge on their own right, but they are also can come into these training sessions, and all your employees, all of them, even though they're exhibitors, they're going to be trained too, because you never know when you bump into asbestos with an exhibit that maybe hit a wall or whatever, or it could be asbestos that's in the building right then and there they don't even know about. They're all being trained. You're going to be training everybody that walks into that building so we can secure the safety of these people coming in.
That's correct. We're training, as I mentioned, the class that was left out in the last category at the Air and Space Museum were exhibits people. And those are folks that put up exhibits but don't necessarily operate heavy machinery, that kind of thing. That class of people is now included in the training.
Okay.
Mandatory.
Thank you, Mr. Secretary. Mr. Longworth?
I think we just had call for votes, so let me just be very, very quick on this. Mr. Secretary, can you tell us how you communicate to your employees when any asbestos work is about to begin? Do you send emails out? Is there official notification? How do you make sure it's done? That sort of thing.
Yes. Well, there's a process that we follow now to let people know that there will be work in the museum. Obviously, if it's a minor project like just putting up a new exhibit, then the public is prohibited from accessing that exhibit, so there's no access by the public at all times. If it's a major renovation project, then we literally isolate that section of the building to prevent people from wandering in or being able to access that part of the building. And in addition, people are informed, the employees are informed about the work and what will happen and how we will respond to any issues that we might have.
How do you know they're informed?
Oh, as I mentioned, we are bringing in an independent consultant who will report to the Office of the Secretary, who will survey our employees and ask them if they feel they've been properly informed. Although we think we have pretty good processes in place, I'm going to take a second cut at it, and we're going to ask them, and they can respond anonymously if they think they have not been well served, and we will look to see to improve that process.
Now, you were chosen in this spot after you had a tough assignment there at Georgia Tech, didn't you? I visited down there. Actually, it was a good day. It was a good night. Notre Dame went down there and played them a couple years ago.
I see.
But you had a lot of
close game, as I remember.
It was. In fact, we had to come from behind, and boy, it was hot and humid there. But I enjoyed it, and thank you for the hospitality. Now, then you had all these different priorities. You had fundraising, you had academic awareness, you had faculty, all that sort of thing. Right now, you've got fundraising, you've got governance, research, education, et cetera. Where does safety line up with those priorities?
Well, safety is one of those issues you always have to keep in front of you, and that's why your processes have to be good to constantly bring it up to the fore. It's another issue like that's diversity. You have to bring it up because it tends to fall off the table if you're not careful, because there are so many daily things that get in your way. And so it's important for us to have a process that brings that to the fore in every way. And I'm committed to see that happen. The folks who are behind me here at the institution are committed to seeing that happen. And I think as I look at the Smithsonian, it's an institution with many moving parts. It has had a history of some almost independence of some of these units because of the historical way they developed. And it's time for us now to recognize that we need a coherent, consistent approach to all these issues. So we're trying to ensure that we have a centralized place where we can collect information and we can remind ourselves of these kinds of issues. Now, the person who works with our facilities and is in charge of all of those things, Allison McNally, is on my cabinet. And so each cabinet meeting, she'll be expected, if there are any kind of issues, to bring these things to us at that point in time.
Thank you very much, Mr. Secretary. Thank you, Mr. Chairman.
Thank you. Mr. Harper?
Thank you, Mr. Chairman. There are 22 buildings in the Smithsonian network of museums, is that correct?
There are 22 buildings just in that, but there are over 700 buildings in total.
Okay. The ones that people visit that are for museums, how many of those would be asbestos-free that people go to visit on the mall? And or do all of them contain asbestos materials?
No, I might get a little backup on this, but I would say any building built recently would not have asbestos in it.
All right.
It's more the older buildings that when people didn't know the hazards of asbestos, that they put the asbestos in as insulation around the pipes as the tapes that they used, and in the case of the Air and Space Museum, with some of the masking material that they used on the joints.
What process do you have where you notify employees that work's going to be done? What is that process?
Yeah. The process would be, again, that we have briefings for anyone who we think will come into contact with these materials, to have broad information briefings for anyone who wants to learn about these materials. And if we're going to start a process in a building, that all the building employees would be informed of this. But anyone, as I mentioned, first of all, you start with those who do this on a regular basis.
Right.
And those have traditionally had mandated training. It's a small number of people who do this on a regular basis. Keep in mind that we have hundreds of contracted personnel who come to the museum as well and do work for us.
Okay, so if you're going to do the work, then every employee will know in some form that that's going to be done.
That's correct. In that building, if they are in any way impacted by it.
Since Mr. Pullman's news came to light, have you had other employees, or tell me how many employees have come forth with similar concerns since him?
No one has come forth with an explicit health issue. There have been a number of people who've said, I wonder if there may be something in my background that I should be concerned about, and that's why we have these free hearings that they can go to and get health screenings and get health advice on these issues.
Have you identified any other material besides asbestos that could be considered a hazardous material that is in these buildings?
There are, and lead is one of those, as you know, in the older buildings, in the paint and sometimes in the pipes. And so lead is an issue for us. And at the Smithsonian, because we're a scientific institution, we have storage of materials like alcohol for specimens. And we have taken great precautions with that alcohol to move it off the mall as much as we can into some of our collection centers out in Maryland, and to put that in a productive category.
Do you make an effort to do some of the necessary repair work that has to be done from time to time, to do that after museum hours?
Oh, yes, absolutely.
Okay.
As much as possible. And obviously, if it's a major project, we're going to seal it off.
And the policy book that you indicated that was a large policy book, I assume there's just a portion of that that deals with safety issues.
Yes.
And is every employee required to read that? Or is it just a reference guide that they can read if they want to, but they're not required to?
Well, that's a very good question. We're going to get much more, we already are getting much more rigorous about who is mandated to have that, go through those processes and be briefed. And for example, it will include all exhibition people in the future. Now, at the Smithsonian, there are different categories of exhibition people, not to bore you with too many details, but there's Exhibit Central, which does most of the exhibits work at the museum, at our museum. It just turned out in Air and Space, they had their own exhibits group. So it was a little bit of a unique category. But we'll make sure, and Exhibit Central has always been part of the asbestos safety training.
Would it be a problem to say that every employee should read? I'm sure it's just a relatively small portion that would deal specifically with safety issues. Would there be a problem to say every employee is required to read that and sign something that says they've read it and are familiar with that? Would that be a hardship or a problem?
That's a good suggestion, and let me take a look at that. I know the safety manual's about that thick, but there are certain portions you'd like everyone to have a look at and to understand. So maybe we can condense it in some way to that small amount of material that really affects everybody.
Thank you very much.
Thank you. Any other follow-up? Thank you, Mr. Secretary. We appreciate your
Thank you very
appearing
much,
up here in front of us. And we do need to go vote, probably about an hour. I know maybe your schedule may be filled. If you can stay, that'd be fine. If not, we would ask maybe some of your staff people can stay in case there may be some questions through the other panels.
I'll be glad to.
So thank you all, and we are going to adjourn for at least an hour.
Thank you.